When it comes to discomfort, back pain is a common complaint. Anyone who has it wants relief. Most Americans will suffer at least moderate back pain sometime in their life, but there are others with chronic conditions as well. Dr. Edward Akeyson is a neurosurgeon and is here to talk about treatment options at MidState Medical Center. Doctor, welcome to Connecticut Style.
Thank you.
Let's talk about some of the causes of back pain.
Well, almost any part of the back can cause back pain. There can be muscular back pain. There can be arthritis in the joints. You can have problems with ligaments, and then very commonly problems with discs. So it can be any or all of those sorts of things.
And why is it so common?
Well, it's a natural process. It's part of aging. It's degeneration, just like arthritis and other parts of our joints. So it's a natural process, and as we age, it's very common.
It's almost inevitable, right?
It is inevitable to some extent, yes.
All right. Degenerative disc disease happens in the early 40s. Describe that for us.
Well, that's a process, again, a natural aging process where the discs start to lose their water content and hence their squishiness, and so they become stiffer and harder. So it makes the spine stiffer, and in that whole process, pain can happen as a result.
And then at what point do you need to talk to a doctor? I mean, you could probably deal with it when it just gets too much.
Most people deal with some degree of back pain throughout part of their life. When we recommend seeking treatment is something that is prolonged and severe, and particularly in my area, when it starts to involve the nervous system. So if people are starting to get neurological problems such as pain radiating down their leg or numbness or tingling, or they can't move their foot, that implies something that's more serious that should be looked into by a doctor.
And there are non-surgical treatments available.
Yes, in fact, most treatment of back pain is non-surgical. Such things as exercise, physical therapy, heat, massage, over-the-counter medications, yoga, Pilates, those sorts of things are very commonly used, and we always try those before we think about surgery.
But at some point, if you don't find the relief, you do turn to surgery.
Yes, for those prolonged conditions or very severe acute conditions, then surgery may be recommended.
Sure. We have a couple of pictures we'll put up on the screen, and you can describe what's happening, but just some techniques to treat lower back conditions.
Right. Today we have a lot of technologies available to treat back pain that we didn't have not so long ago, and this is allowing us to treat broader conditions that we weren't able to surgically because it was just too hard. And one of them we have now is a way of getting three-dimensional images of what we're working on while we're working on it in the operating room. It's called a three-dimensional C-arm. That's what we have here in the picture. And this rotates around the patient. Rather than giving us a flat picture, it gives us a three-dimensional image of what we're working on, so we can more fully understand what the problem is and right in the operating room.
Okay.
We also have what we call navigation systems, which are like a GPS for the spine or wherever we're working. So we have probes that the system can tell us where we're working. So it's like it's like somebody laying a road map over what we're doing. And so again, this allows us to do this with much smaller incisions and creating less problems because we don't have to see a broader area of real estate. This sort of GPS type technology takes us right to where we need to go.
I would assume less recovery time if there's less of an incision.
Correct. There's less recovery, less pain, requiring less pain medications, back to life quicker.
Very good. And what did you bring with you today, Doctor?
All right, we have some as things get smaller and smaller, again, rather than making a traditional incision now, we can use some techniques such as the endoscope, which is here. It's very much like what is used in joints, knees and shoulders, and in laparoscopy, but we now have applications for the spine, and rather than making an incision, it goes through a small tube like this, and there is a fiber optic cable and a camera that sits here, and we can see what's down here at the tip without making a large incision and interfering with things. So that is the first step in those.
We could see it on the screen there, kind of really coming to life.
Right. This is a picture of using an endoscope to treat a herniated disc. So again, instead of making an incision over the spine, we make basically a small puncture hole and put this endoscope down right where the problem is. Again, using some of these other technologies to guide us, we get right there. And again, we can see on the camera what we're looking at rather than having to open things wide up.
Sure.
And The next sort of phase of evolution of that is that we now can replace certain parts of the disc, treat the disc, and this is with fusion technologies. And again, we can deliver these devices through small tubes, again, rather than making a large incision. So they go down a small tube, and then with the proper manipulation, they will expand to fill the defect that we need. And then they can be left in place and all of these things pulled out.
Wow.
So we used to have to make large incisions and do a lot to the muscle to deliver these technologies, and we don't really have to do that so much anymore.
How much time does it knock off from the recovery?
Oh, depending on how much you're doing, it can knock off hours.
Oh, wow.
And I think we're not too far from being able to do sophisticated back surgery in under an hour.
Wow, that's impressive stuff. Doctor, thanks so much for being here. We'll put some information up on the screen. MidState Medical Center is located in Meriden. For more info, call 1-800-DOCTORS or visit midstatemedical.org. Interesting stuff. It's come a long way, right?
Yes, thank you very much.